So, hi everybody, and welcome to the IH Manchester session on OET. OET is a new exam course that we are starting to help prepare our students for. So I thought that today would be a really good opportunity to catch up with Marie and Joseph, who are our Assistant Directors of Studies at IH Manchester, just to find out a bit more about what OET is, because quite honestly, I didn't really know that much. So hopefully it'll answer our questions. So I'll start, I think, asking Joseph, like the simple question, what is OET, Joseph? And like, who needs it? What does it allow these people to do?
So the OET stands for the Occupational English Test.
Okay.
So it's a test of English, obviously, but it's designed specifically for healthcare professionals.
Ah, brilliant.
That includes a range of different professionals. It goes like dentists, doctors, nurses, pharmacy, even vets. And it allows them, once they pass the test, to register and work in an English-speaking, English-speaking environment. It doesn't have to be the UK. Actually, it's accepted in quite a lot of different countries around the world.
Okay.
UK, Australia, New Zealand, Singapore, all sorts of places.
So passport to work in any of these places where
Exactly. Yeah.
English is
Yeah.
used as the language. Marvelous. So vets included as well. That's interesting.
Yeah.
Great. So was it something new to you guys teaching medical English? I mean, that's probably a next good question to ask, because we've had a lot of new stuff in the last 9 months.
I think it's kind of an extension, as it were, rather than a completely new thing. Like, obviously, there's always been basic medical vocab in any sort of English course, but it's extended that into a lot more sort of high level, specific kind of English that maybe the kind of things you might use all the time or hear all the time when you go to the doctor or the hospital, but you've never actually sort of had to think about teaching it before.
Yeah. So yes, it's a kind of different register that you kind of
Yeah,
would
exactly. Yeah.
dip into if you were in that situation, but to teach it. That's interesting. What about you, Marie?
Yeah, for me, I'd say the same. It's definitely been a new thing in terms of specifically teaching doctors or healthcare professionals. And I think it's interesting because it's it's an exam course, preparation course, but obviously there's the language built into it. So I think for me, I have experience in teaching exam preparation. So, those things are similar. And I have experience in teaching sort of other specific areas of English. So maybe other professions, people that need English for a very specific kind of job. But yeah, this is the first time I've done sort of medical English for an exam, combining those things.
Brilliant. And I mean, this thing whereby people are learning English now with a real specific goal in mind, a really specific outcome. Would you think that that's, it sounds like a leading question, but I'm trying to keep it open. Do you think that it's kind of evident that there's a bit of a trend that way in the last sort of 6 to 9 months? Have things moved a little bit more specific? I don't know what you think about that.
I think in terms of this test, I mean, just think about medical English, because nowadays it's becoming more and more recognized in the UK and those other countries, Joseph mentioned before, as a kind of recognized exam of someone's level of English to work in a healthcare setting. Whereas before, that the IELTS exam was the one that people had to do. And often the problem was that it was very hard to pass that exam when it didn't really relate to the actual work that people will be doing. So I think, now it's like an exam has been developed and has become more recognized, which does reflect the actual kind of real professional setting that people will be working in. So I think it's that kind of recognition that there needed to be a more specific exam. And a lot of people were really struggling to pass their IELTS in order to work here, but they had the skills, they could do the job. They just, were struggling to pass an academic English exam that wasn't relevant to their job.
See.
If I don't know if you have any thoughts about in general.
Yeah, I was just thinking, I think it's a very interesting point that you raised, Pete. I think with the sort of increase in online teaching that we've had over the past sort of 9 months or something, I think it is probably likely that we are seeing more specific tailored kind of courses for people because people can do it from wherever they are whilst they're working without having to, travel to a new country to learn a language or something. So I think it probably is becoming more common to have specific class types.
Interesting, thank you. That's it. It certainly seems to be, doesn't it? So it's interesting that what you say there. I think it'd be interesting for people to understand, is there anything different about how you approach these lessons, specifically OET?
Well, I think for me, it's a yes and a no at the same time. I think obviously that the vocabulary that you're teaching is quite different. It's very specific, topic-based vocabulary. As we said before, there's a lot of a different register than people might normally need to learn English for. So there's a lot of that kind of new stuff there. But at the same time, as Marie mentioned earlier, the strategies that are used in an exam almost kind of cross exam boundaries. Like it's very, very similar strategies, no matter which exam you're taking. So, we can bring our experience of teaching other exams into teaching OET to be able to help them with actually specific strategies for reading or for listening, and, like actually combine the new stuff of the specific vocab and the specific exam things that for that exam with our experience of what we know already from previous exams.
Interesting.
I think as well, because a big part of the speaking test for OET is about communication skills, being able to say the right thing, to show understanding. And I think a lot of that is what we do in our general English classes anyway. There's a lot of kind of general communication skills and responding with the appropriate, whether that's a sound or a gesture or whatever, as well as the actual language. So I think there is a big focus on that rather than just the vocabulary. So I think it does combine things that we're used to doing in other classes just for that specific exam context.
That's brilliant. Those are good points. I hadn't thought about that. It's like it's an identical skill set that you've got. You can then import to this specific subject.
Exactly.
Yeah. Brilliant. And do you have to use any specialized materials for this? I would imagine you would.
Yes, so we do have materials that have been specifically designed for OET preparation, which, as we said before, they're kind of combining exam practice, so students can see the type of questions that they're going to get. They can do specific exam practice, but also kind of looking at the strategies and the vocabulary that they need. So again, a little bit like in other exam classes where you see exam material and then you see general kind of material to help prepare for the exam. But yeah, they've all been the course has been specially designed and written for students preparing for this exam. So they get exactly what they need. They see, they become very familiar with the exam as they go through the course. And I would say it's an important thing about that is that there's kind of a mixture of sort of specific terminology, medical terminology, which is maybe more medical, maybe more scientific, and the sort of lay terms, which your average patient might use as they come to speak to the doctor. So a lot of that again is maybe what students need. They might have the specific language from their medical background, and especially if they're words from Latin that might be the same in different languages, but what they don't have is the kind of more slang, more informal language that they're likely to encounter, especially if they're working here in the UK. So it's sometimes it's using the materials and then contrasting with what they might actually hear in everyday language, which the teachers can bring to that because it's the kind of language that they would use themselves if they go to see the doctor, for example.
That's a really interesting point, and I bet that makes it interesting for the teacher, I would imagine, that aspect of it.
Definitely, yeah. And I think that's where that's definitely something that the teachers can bring, because the students might have the knowledge, they obviously they need to learn to pass the exam, but they won't necessarily have that knowledge of the everyday language, which they might not also realize that they need that and how important that is. So I think the exam preparation obviously is going to help them when they're actually working in that setting as well, and give them the skills that they're going to need, not just to pass the exam, but to do a good job afterwards when they're working.
Brilliant. Because there's this thing that people known as bedside manner, isn't there? The way that a healthcare professional for. And so
I think as well, I just add that a lot of that, as you mentioned, like Peter, the the sort of bedside manner thing is quite culturally based as well as language based. So I think having, you know, the experienced language teachers that come from an English speaking culture, again, it's really, really useful because we're able to pass on that, not just the language, but the cultural sort of situation of what language is appropriate and why it's appropriate.
Brilliant. It sounds fascinating, this stuff. So the materials that you use, Marie, you've actually sort of mentioned that they're good because they are medical materials, so they're specifically designed. Is there anything else that's good about the materials that you'd like to say?
I think, as we said before, they combine all those things that students need. So they get the actual exam style questions, but there's a lot of work on strategies that are needed for the exam. So and because there are materials that, you know, students can choose to have self-study materials, they can access online course for self-study or join group class or do one-to-one classes. So for example, with the online stuff, there'll be a kind of big focus on developing those strategies that they need for the exam. And then, alongside the vocabulary. And then obviously if they have classes with a teacher, the teacher can help with things like the speaking, like we said, if the kind of the manner is appropriate, they're not saying things that might, you know, offend someone. With the writing, obviously they can get writing correction from the teacher, but the materials themselves will, give examples from the exam and the type of strategies that need to be employed.
Brilliant. Fantastic. So guys, do you think it's an interesting topic to teach, or was that me just guessing that? Is it actually interesting?
I would say definitely, yeah. I think
I'd agree.
Something a bit different, and I think for me one of the most interesting things about it is because it's very practical. It's very, you know, you're helping people to do something, like we said, not just to pass an exam. That's the first stage, but it's, you know, real life practical skills that they need in order to practice their profession. And I think, you know that this is something that's going to help them, that they're going to be able to use. You know, and it could be that there are students that are already working in some kind of you know, healthcare setting, and they're preparing to do this exam in order to, you know, be able to maybe move up a step there. So often, you know, it could be things that they're already using in their day-to-day work. So, you know, you can see they can put it into practice straight away. So I think, that real practical element for me makes it interesting.
I think for me, what I like is that it's a topic that all the students are interested in and they all want to know about. All too often as a teacher, you're sort of using textbooks or teaching to a large range of students where some of them will be interested in some topics, others won't be. So you have to kind of try and balance it all the time. Whereas this is, you know, because it's so specific and they're medical professionals, they can all relate to it. They can all get on board. It's accessible to everyone and generally speaking, motivating to everyone, I think.
Really good points. Yeah, I hadn't even thought of that. Of course. So that, I think this has been a fascinating insight into this new direction of OET preparation, and I think it must be very satisfying to realize that what you're doing is facilitating somebody to actually carry out some really valuable work at a time when, let's face it, the whole world needs it right now.
Definitely.
Yeah. Definitely.
So thanks ever so much for your time, and see everybody soon.
Bye.
Thank you.